Hi, today I'm going to talk to you about conducting vaginal exams and how to do them. First off, there can be different reasons why we do a vaginal exam. So, one of the first reasons could be pelvimetry. So, that is assessing the pelvis, the shape, the size, what kind of pelvis it is, what characteristics it has. And that can actually be done by, well, before we go there, and then we have the other vaginal examination, which is assessing dilation, station, and effacement. So we have those as well, and we can see with the vaginal examination exactly the progression of labor as well. So the first thing I would do, I'm just going to kind of demonstrate my pelvic model. Never came in the mail and it got lost and it was a huge thing, so I'm just going to show you with a pillow. So basically the first thing I want to do is, get like a Chuck's pad down or something and either have the mom on maybe a massage table or something that is slightly reclined but not too much. And then I'm going to have the client sit up on the, say, massage table, because that's what we use in our practice. And I'm just going to have here next to her, I'm going to have a Chuck's pad underneath her, of course, but also a big one that she can cover herself with. And then I'm going to ask her, of course, being very considerate and sensitive, I'm going to ask her if she can remove her bottoms and she can cover herself with the Chuck's pad. And I'm going to leave the room and let her do that so, it's a little more comfortable for her. And I'm also going to talk to her through the process as well. So first I'll do that. And then when I come back, I'm going to get all my things ready. So to do the vaginal examination, I need gloves, sterile gloves, and I need lubricant. So with the sterile gloves and the lubricant, I basically just put it on my hand and I talk to the client and I let her know I'm going to have her kind of in like a stirrup position or a butterfly position. If she can just, if she can open her legs to allow me to do the exam, I'm going to ask her if she feels comfortable, and that we can ease into it. And if she's uncomfortable at any time, she can tell me to stop, and I will. That way she knows she's in control of the exam. In terms of if we're dealing with women with abuse, it's really important to ask them if they prefer somebody else to be in the room as well, like another staff member or another family member or friend, just to be a witness, basically. So the first thing I'm going to do is I'm going to have her go in that butterfly position, and then I'm going to, with my two fingers right here, I'm just going to kind of separate the majora labia to kind of separate and find the opening for the vaginal canal. So I'm going to find the opening, and I'm going to, so with my two fingers, just kind of see where the vaginal canal opening is. And then from there, I'm going to slide one finger in, and then from there, I can kind of see where you can use two as well. But I'm just going to go very slowly, and I'm going to let her know this is, you're going to feel my fingers, and you're going to feel me going in now. So I'm going to be talking to her through this whole process so it's not as uncomfortable for her. So I'm going to go, and you always want to go in with a purpose. So I'm going to go in, and I'm going to try to feel for the cervix. Now it kind of feels like puckered lips, like that. It could feel like that, or it could feel softer. It just depends if she's dilated or not. So I'm going to go in, I'm going to feel the cervix. Now what I'm going to feel is I'm going to see, and also when you put your hand here, you want to be very careful that you're not putting pressure on the clitoris. That's really uncomfortable. So it's important to make sure you're not putting pressure on the clitoris. So I'm going to check for dilation. First thing I'm going to do is see if the cervix is open. Can I put one finger? Can I put any fingers in it or not? That's going to determine the dilation. Then I'm going to see the effacement. So that's basically the thinning of the cervix. And then I'm also going to check for station. So where, in terms of the maternal pelvis, do I feel the fetal head or the presenting part? And that's going to be determining station. So after I've got all this information, I'm going to let her know you're going to feel me coming out now. And then afterwards, I'm going to let her know, okay, we're all done. Give her a tissue so she can wipe herself. And then I'm going to take my glove off. I'm going to put a fist, and I'm going to put the glove over my fist so I don't get any of the contents outside of the glove. And then I'm going to throw away my glove, and I'm going to also let her know that we're done. I'm going to let her know the information, her dilation, effacement station. And then I'm going to leave the room and let her get dressed again. So that was the how to do a vaginal exam. Thank you.